Hello, and welcome to the Awards Luncheon presentation. My name is Narissa Legg, and I'm the Professional Development Director with the FLC. I'm honored to introduce our moderators today. We have Claudia Haywood. She is the FLC Mid-Atlantic Deputy Regional Coordinator, and Carmen Krieger. She is the immediate past FLC Mid-Atlantic Deputy Regional Coordinator. Claudia, when you're ready, please take it away. Thank you both.
Thank you, Narissa, and thank you all for joining us today as we celebrate the profession's outstanding achievements. Carmen and I will be your hosts as the outgoing and current Mid-Atlantic Deputy Regional Coordinators, respectively. As this ceremony is in a virtual format, our new normal these days, we are doing things a little bit differently, but we'll be including key insights from the award winners. Carmen?
Thanks, Claudia, and good afternoon, everyone. It has been a pleasure serving as Deputy Regional Coordinator, and I'm pleased to be a part of the ceremonies one last time. We also want to thank this year's judges, because without them, we would be unable to continue this awards program.
I totally agree with you, Carmen. And I hope to see some new volunteers next year. So that's our call out to everyone who's interested or who knows someone who might be a good candidate to be a volunteer and to judge for next year. The Mid-Atlantic region has 9 award categories that could be applied for each year. Today, we are fortunate to honor winners from the following categories: Excellence in Technology Transfer, Educational Institution and Federal Laboratory Partnership, Interagency Partnership, and State and Local Economic Development. Today's first category to be recognized is Excellence in Technology Transfer. In this category this year, we have 2 winners. The first awardee in this category is a team from the National Cancer Institute that developed a partnership with Ad Astra Pharmaceuticals that has led to an orphan drug designation for a new cancer treatment and a clinical trial to move the treatment closer to commercialization. That's our goal. Glioma, as everyone knows, represents 80% of all malignant primary brain tumors. Types of gliomas include astrocytoma, epidioma, oligodendroglioma, and others. And despite recent advances in surgical techniques, radiation, and chemotherapy, this disease remains incurable. Standard therapy consists of extensive surgery, if surgery is even possible, and it's followed up by radiation therapy and chemotherapy. However, most patients experience some form of relapse, and the median survival is less than 15 months, unfortunately. Thus, there is a large unmet need for the development of effective treatment for gliomas. In the field of cancer research and the development of treatment, this is an exciting development, and there is more information about this awardee in your awards booklet. We are fortunate that 2 team members, Drs. Michael Pollak and Jin Woo, will now provide you with more details about.
Hello, I am Michael Pollak, a Supervisory Technology Transfer Manager at the National Cancer Institute's Technology Transfer Center. In my role, I support the technology transfer efforts of the neuro-oncology branch, including the research and discoveries of Drs. Gilbert and Woo. NCI used several technology transfer mechanisms to initiate and advance this collaboration with Ad Astra Pharmaceuticals. Our ability to swiftly negotiate and execute various agreements helped zotiraciclib to be more rapidly translated from the bench, preclinical experiments to the bedside, first clinical trial in brain tumor patients. For example, a clinical trial agreement was negotiated and fully executed in 2 months, which is significantly faster than a typical CTA negotiation. This allowed the NCI clinical trial to begin without delay. The development of zotaraciclib furthers the NCI's mission to promote the discovery and advancement of new cancer treatments, especially for the treatment of rare cancers such as gliomas, which may not benefit from large public financial support. The partnership between NCI and Adastra Pharmaceuticals brings together partners with complementary expertise. Also, the attainment of orphan drug designation is an important milestone. This designation is given to therapies that treat, prevent, or diagnose rare diseases. Although this designation does not necessarily mean that the treatment will be approved by the FDA or reach patients faster, it enables the drug's developers to receive incentives such as tax credits and provides them exclusive rights for 7 years to further the treatment's potential for that condition. The combination of Adastra Pharmaceuticals' proprietary anti-cancer drug and NCI's expertise in research, design, and execution of preclinical and clinical trials is advancing development and clinical application of a new cancer treatment for patients with gliomas.
Hello, my name is Jin Woo. I'm a neuro-oncologist and a cancer researcher in the neuro-oncology branch at the National Cancer Institute. Working with my colleagues in the neuro-oncology branch, I'm conducting clinical trials to investigate novel therapies while I'm running a translational research program in the laboratory. At a broad level, my research in the laboratory is focused on preclinical studies in malignant gliomas. In 2015, NCI Technology Transfer Center facilitated a way for my lab to conduct preclinical studies on zotaraciclib, an investigational cancer drug that is proprietary to our industry partner, Adastra Pharmaceuticals. Our findings from these early preclinical studies paved the way for ongoing clinical trials for the treatment of patients with high-grade gliomas, which is an extremely aggressive and malignant brain tumor. Zotaraciclib has potential to block multiple pathways that cancer cells use to replicate and survive. It has good penetration of blood-brain barrier, which is an essential quality for the therapeutics against brain cancers. We're not only learning about novel ways the cancer drug works, but also studying its use in combination with temozolomide, a standard chemotherapy drug used to treat patients with glioblastoma. Preclinical evidence suggested that zotaraciclib and temozolomide can effectively work together to fight glioma in a way that is synergistic. Despite recent advances in surgical techniques, radiation and chemotherapy, this disease remains incurable. Most patients experience relapses, and only about 1/4 of a glioblastoma patient can survive 2 years from the time of their initial diagnosis. This highlights the large unmet need for the development of effective treatment of high-grade glioma. In January 2020, the US FDA and European Medicines Agency granted orphan drug designation to zotaraciclib as an investigational treatment for glioma, suggesting that the investigation has a great potential to address the critical unmet need for the development of effective treatment. Without technology transfer services, our preclinical and clinical studies of this novel drug would have not been possible.
That was great. And thank you to Drs. Woo and Dr. Pollak for that overview. And congratulations again to the National Cancer Institute. Carmen will now tell us about our second winner.
The next Excellence in Technology Transfer Award winner is the U.S. Army Medical Research and Development Command's Medical Technology Transfer Office. Civilians, as well as warfighters, can now benefit from the USAM RDC system for treating exertional heat illness thanks to T2 diligence and a smart reboot for a stalled license negotiation. The body cooling system, which was named the Arm Immersion Cooling System under its original patent, is a life-saving device that is used to treat overheating of the body. Due to a variety of factors, such as exertion, environmental conditions, fitness level, illness, or toxins, human core body temperature can rise to levels that are harmful or fatal. Nisha Harris has more information about this T2 effort.
Emergency case, the body cooling system can also be used as a total immersion basin for someone who's actually realizing heat exhaustion in hot environments. Again, hot environments can be whether on an athletic field or working in a hot, humid environment somewhere in the Southwest or Southeast United States. And so the application of the body cooling system has numerous opportunities for firefighters, for EMTs, for, again, construction workers working outside in hot, humid environments. It is being licensed now by First Line Technology, a small business 8A operation in Chantilly, Virginia, whose primary purpose is to provide EMT-type medical devices to improve health and safety of patients and or the firefighters or the individuals who are actually assisting patients in hot environments.
Congratulations again to USAMRDC's Medical Technology Transfer Office. Back to you, Claudia. You'll introduce the next awards category.
Thanks, Carmen. And for those of you who may be listening to Carmen, she is experiencing a little bit of audio difficulty. So we just wanted to make you aware of that. The next award category to be honored is the Educational Institution and Federal Laboratory Partnership. As with the previous award category, this year, we again have two winners. The first one is the National Center for Advancing Translational Sciences, NCATS. And this is being awarded for its work with Cincinnati Children's Hospital in advancing anti-leukemia product. As with all of the awardees today, there's a description of the award in your packet. But in brief, NCATS, which is part of the National Institute of Health and the Cincinnati Children's Hospital Medical Center, a teaching hospital, collaborated to develop small molecules for treating MDS and AML. AML and MDS are both blood cancers that urgently need improved treatments. Collectively, more than 30,000 new cases of MDS and AML are diagnosed in the United States each year. The median survival time of MDS is only about 2.5 years after the initial diagnosis, and the 5-year survival rate for AML is only 27%. This collaboration includes the co-development of a new treatment that will have the potential to provide long-term benefits for MDS and AML by inhibiting what's called IRAK and FLT3. The NCATS Office of Strategic Alliance worked very closely with the Cincinnati Children's Innovation Ventures, a unit of the Cincinnati Children's Hospital that facilitates the translation of discoveries into improved care for children to explore pathways to support technology development through the late preclinical development phase, what's called the Valley of Death. This phase of product development, as most of you know in this profession, often fails because it's significantly more expensive than early stage discovery. It involves lengthy process development, scale up of technology, toxicology testing, and it's less likely, in fact, the least likely to receive any federal funding and support. To make this type of collaboration work, NCATS entered into an interinstitutional agreement that allowed CCIV to take the lead in filing its intellectual property protection and patent applications, marketing, and exclusively licensing their joint intellectual property. CCIV filed and secured the intellectual property protection for composition of matters and method of use for those inhibitors that were listed and necessary for commercial development. In late January of 2020, prior to the pandemic, CCIV facilitated the creation of a new startup called Curome Therapeutics, whose mission is dedicated specifically to the preclinical and clinical development of the novel IRAK and FLT3 inhibitors. CCIV facilitated Series seed funding for Curome from Cincinnati Children's and investment funds, including from the Cincy Tech Fund. CCIV also recruited an experienced entrepreneur in residence to manage the project operation and to coordinate production development by NCATS and other CCHMC investigators. Many of you are very familiar with the EIR process and the use of a manager to assist in that, and that was very critical in all likelihood to the success so far. NCATS and CCIV worked together to enable CCHMC to enter into an exclusive license with Curome for the intellectual property that was developed. CCHMC, Curome, and NCATS also entered into what's called a CRADA, providing Curome with options to license future IP that's relevant to those inhibitors. The exclusive license agreement and the CRADA, both together, are anticipated to provide Curome with a sustainable intellectual property portfolio and put them on a clear pathway towards startup success. Congratulations to all of those organizations and entities involved in this important partnership. Carmen, on to you for the next winner.
Goddard Space Flight Center with their submission, Jeffrey Bland and the AeroPod team. NASA engineer Jeff Bland has long been interested in simple, inexpensive devices to keep cameras and other sensors airborne. Thanks to a school project in Wayne County, Michigan, that interest has facilitated an educational partnership that has benefited thousands of students nationwide and is helping to shape the next generation of scientists. NASA was able to provide us more information on the details of their award submission. When asked about the importance of the technology going forward, they said, thanks to its novel design, the AeroPod has significant benefits over the traditional pulley-style suspension system for kite flight because it's lightweight, simple to construct, and has no moving parts. Furthermore, the AeroPod design is advantageous to the traditional tethered blimp suspension technique, where tether motion is translated directly to the sensor system because the AeroPod is relatively free of direct motions of the tether. It enables payload deployment on these platforms at a much lower cost, which makes it affordable for small businesses and educational science projects. When asked about the technology's marketability, they said, the Strategic Partnerships Office at NASA's Goddard Space Flight Center continues to use marketing strategies for the AeroPod technology to both commercial and educational users. The inventors will continue being great ambassadors in promoting this and other technologies in the kite, tethered balloon, and UAV research and education communities. When asked about the benefit to the general public, they said, the advancing Earth research observations with kites and atmospheric and terrestrial sensors, or the AeroCats program, is aimed at providing new tools for simple, easy-to-field observation systems. Aeropods are one result and can help benefit the general public in many ways. As a learning tool, Aeropods offer educators and learners of all ages an excellent tool for their science curriculum through observation and analysis-related educational programs. The AeroCats and Rover Education Network project enables participants to design aeropods for agricultural and environmental research purposes. Aeropods can be great tools for introducing students to the world of remote sensing, thanks to the ease and accessibility that come with kite flying. At this time, NASA Goddard Space Flight Center has issued 9 licenses for aeropods to educational institutions. As these licenses are non-exclusive and educational, the technology is available for others to license. The Aeropod is a low-altitude, custom remote sensing platform, craft designed for, but not limited to, agricultural and environmental research purposes. Aeropods can be used for a variety of remote sensing applications, including in situ atmospheric measurements, observing and documenting forest canopy and cover, assisting in wetland studies, archaeological and geological mapping, and crop monitoring. Jeffrey Bland and the Aeropod team would like to thank the Goddard Space Flight Center for enabling the research and commercialization support, the NASA Science Activation Collaborative for including this technology in a comprehensive SMD outreach effort, and the University of Maryland Eastern Shore for partnering in early application research and demonstrations. Congratulations again to NASA Goddard Space Flight Center and their educational partners. The next awards category is the Interagency Partnership Award. This award recognizes the efforts of federal science and technology employees from at least 2 different agencies in the region who have collaboratively accomplished outstanding work in the process of transferring the technology. Scientists from 3 FLC Mid-Atlantic region agencies have collaborated to update the respiratory testing process used to verify the safety of the nation's emergency responders. The collaboration included the Department of Homeland Security's Science and Technology Directorate, Chemical Security Analysis Center, the U.S. Army's Combat Capabilities Development Command Chemical Biological Center, and the National Institute of Safety and Occupational Health's National Personal Protective Technology Laboratory. Dr. Lean Greenwald of NIOSH will now provide us with more detail on this award-winning effort.
My name is Lee Greenwald, and I am with CDC's National Institute for Occupational Safety and Health, or NIOSH. On behalf of our partners, we are honored to receive the 2020 Interagency Partnership Award from the Mid-Atlantic region of the Federal Laboratory Consortium for Technology Transfer. Our project team is comprised of scientists and engineers from NIOSH's National Personal Protective Technology Laboratory, the Department of Homeland Security's Science and Technology Directorate Chemical Security Analysis Center, and the U.S. Army's Combat Capabilities Development Command Chemical Biological Center. The success of our project can be directly attributed to an effective interagency partnership between these 3 organizations, where our team leveraged the knowledge, talents, and authorities of each agency and created an environment where novel ideas and concepts were embraced and explored towards meeting our shared goal, which was to protect the nation's emergency responders by ensuring their respirator technologies would provide them the necessary protection. Emergency responders rely on NIOSH-approved respirators to prevent inhaling chemical, biological, radiological, or nuclear, or CBRN, hazards. As one part of its respirator approval process, NIOSH evaluates CBRN respirator canisters by testing them with 11 test representative agents, which were selected during a 2001 CBRN hazard assessment, which was based on the hazards landscape at that time. However, CBRN hazards are constantly evolving in type, usage, and dissemination. Further, hazard assessment modeling has become much more sophisticated, and the understanding of filtration science has vastly improved. NIOSH was funded by CDC's Office of Public Health Preparedness and Response to conduct an updated hazard assessment to ensure NIOSH-approved CBRN canisters continue to protect emergency responders. The Department of Homeland Security's Chemical Security Analysis Center scientists, who have extensive expertise in Homeland Security chemical threats and risks, were responsible for reviewing chemical hazard assessments using the latest state-of-the-art modeling tools and updating the list of chemical and radiological hazards. The Department of Defense's Chemical Biological Center and NIOSH scientists were responsible for interpreting the hazard assessments and applying cutting-edge science to evaluate the anticipated canister filtration capabilities. NIOSH was responsible for providing expertise regarding its respirator approval program. The project's findings showed that NIOSH's test representative agents remain representative of the newly identified hazards and ultimately provided confidence to the nation's emergency responders that NIOSH-approved CBRN canisters continue to provide the necessary protection against the latest identified chemical and radiological threats. Additionally, a standardized technology-based methodology was developed to conduct future CBRN hazard assessments, which was an important scientific advancement. The results of the work were transferred to respirator manufacturers, laboratories, end users, and other stakeholders in the form of journal publications, conference presentations, posters, and verbal updates at NIOSH-sponsored manufacturer meetings. Importantly, there has and will continue to be extensive outreach to the responder community in the form of trade magazines, NIOSH blogs, and updating various NIOSH CBRN resources. In closing, we would like to thank the Mid-Atlantic region of the Federal Laboratory Consortium for Technology Transfer for hosting this award ceremony, and CDC for funding and providing critical input to make this project successful. Additionally, an important attribute that greatly contributed to the success of our project was that each agency had excellent leadership and administrative staff who diligently worked to execute the interagency agreement. Finally, we would like to thank Jim Zarzicki for submitting our project team for this award. Thank you.
Thank you, Dr. Greenwald, and congratulations to all of those agencies involved. The last category to be celebrated this year is the State and Local Economic Development Award, and this year there is one winner. This year's award winner is the National Institute of Standards and Technology for their work with the NIST Science and Technology Entrepreneurship Program, or NSTEP. Dr. Willie E. Mays, the former Undersecretary of Commerce for Standards and Technology and the Director of NIST and current Vice President for Research and Economic Development at Morgan State University, will give more details on the origins and the impact of the NSTEP program in this video.
Good afternoon. I am Willie E. May, Vice President for Research and Economic Development at Morgan State University. I am also the immediate past Undersecretary of Commerce for Standards and Technology and the Director of the National Institute of Standards and Technology. I've been asked to say a few words about both the inception and some of the early success stories regarding the NIST Science and Technology Entrepreneurship Program, or NSTEP. Now, the NIST mission is to provide U.S. innovation and industrial competitiveness by advancing measurement science, standards, and technology in ways that enhance economic security and improve our quality of life. Now, historically, NIST has accomplished this primarily by conducting world-class research in measurement science, for which we've obtained 4 Nobel Prizes, among other things, over the last 25 years. The provision of standard reference materials to calibrate measurement instrumentation and validate measurement results. The provision of reference data where such data cannot be obtained from academic or commercial sources with the needed level of accuracy. However, there's another mode for realization of our mission, technology transfer, which I might add has been taken to the next level by my successor, Dr. Walt Copan. The NIST Science and Technology Entrepreneurship Program was launched on November 18th, 2015. It is a joint effort by the NIST Technology Partnership Office and the Maryland Technology Development Corporation, or TEDCO. Its purpose is to help accelerate the transition of NIST-developed technologies to the marketplace. This program is open to NIST employees who are nearing the end of their short-term appointments and focuses on commercialization of work initiated during that term appointment at NIST. Back in 2014, I was sitting in a meeting in the White House with colleagues who were leaders of other federal agencies. And we were locked down because someone had tried to breach the fence and they had everyone to shelter in place. During the time that we were there, a discussion started about what the various federal agencies might do to improve a transfer of technologies that were developed with public or federal dollars to the marketplace. And I began to think about, well, what do we have at NIST that might be unique and the other folks around the table don't have? And what I thought about is the fact that among the folks who were in the room, we were the only ones who had a very, very active postdoc program. So I authorized the InStep program to increase lab to market transfers by leveraging the talent and creativity of the NIST postdocs. And NIST has an average of 85 NRC, National Research Council sponsored postdocs that join the agency each year. Historically, NIST retains around 35% of those for longer term employees, and others move on to jobs in academia and or industry, or other federal agencies for that matter. InStep is designed to encourage some of those departing researchers to launch startup companies based on the research that they conducted during their stays at NIST. Some of the technologies that have been developed include a low temperature ion source for nanomachining and nanomicroscopy, a chip scaled hybrid gas sensor for indoor air quality monitoring, a system for separation of pathogenic bacteria from food samples for food safety, a rapid biophysical diagnostic for antimicrobial susceptibility for the development of antibiotics, affordable quantum resistance standards based on graphene, and a method for laser particle separation on the nano and subnano scale for improved pharmaceuticals. The first two examples that I just gave have already reached the marketplace. A couple of platform technologies in addition, a couple of those mentioned are platform technologies that have the potential to change entire industry sectors. There's so much to be proud of based on the spinoffs from this program. To date, there have been 13 awards approved in total, and 11 awards have been made. 3 of these are to early stage companies that were spin-outs directly from NIST. 8 are startups formed with in-step funding. 2 have not yet completed their projects, so they haven't begun the process yet. 3 of these companies did not make it, which is typical for startups. But 6 others that did collectively account for more than $2.7 million in annual resources, $1.2 million in investment, an additional $4.8 million in funding from grants that these companies have won from other sources. Collectively, 26 new jobs have been developed, and that's through February of this year. So in accepting this award on behalf of the NIST Technology Partnership Office and TEDCO, I would like to thank the NIST staff that supported this effort, most notably Phil Singeron, former Associate Director for Innovation in Industry, who suggested to me that we implement this idea through the NIST Technology Partnership Office. Dr. Paul Zielinski, former Director of the Technology Partnerships Office there at NIST, who is now Executive Director of the Federal Laboratory Consortium, and Dr. Dawn Archer, the NIST Patent and Licensing Officer. The TEDCO staff that managed the InStep program and mentored the new NIST startup companies, most notably Ronald Casey, TEDCO's Director of Federal Programs. But most of all, we all need to thank those former postdocs who, upon leaving NIST, or the decision to leave NIST, decided to take the risk and seize the opportunity to start their own businesses as part of this program, and leverage the investment made in them and their research to create new jobs and strengthen the local and national economy. Thank you.
So thank you, Dr. May, and congratulations to all of the 2020 Mid-Atlantic Award winners. Again, information about all of the awards is in your booklet and available to you. I invite everyone to join us in the networking session at the end of today's meeting. And in addition, I want to take a minute to thank Carmen for all of her hard work the last 2 years in shepherding the awards and working with me the past few months in getting this award program together, as well as Catherine for all of her assistance and hard work in getting this program together. One last point I want to make is a lot of times we have not received as many nominations as we think we probably could receive. And we hope that this year we will have an opportunity to maybe have a workshop on how to prepare your award submission so that we have a lot more potential awardees to see next year at this program. So look for that to come in the future in this year. And I hope that we've given you an extra few minutes for your lunch. And I turn it back over to our FLC folks.
Fantastic. Thank you, Carmen and Claudia, for moderating this awards luncheon. It was really great. It was so nice to hear from all of the award winners. There's just one question, and we have just a few minutes, so I'll ask that one question. And it's just, what do you see as the future for FLC awards?
Well, as I mentioned, Narissa, that's a great question. What we hope to have are more submissions, obviously, going forward, and to give folks the opportunity to share with us what's going on in their laboratories, what excites them about tech transfer in their laboratories, more information about partnerships and collaborations across different agencies, which I think is exciting for all of us to see. What makes it work? What didn't work, and what trends exist to show success in technology transfer. So I think that going forward, as we get more submissions, we will have more judges who will have the challenge of determining what looks like a good submission, what's exciting in the field going forward, and hopefully we'll have more participants in the award process. This year we were not reluctant to award more than one awardee in a category. And I think in the future, we'll see that again. When we see tech transfer success, we should reward and announce it amongst our peers and our peer groups. And in this year, we saw that and we recognize that. And I think that's a good thing going forward.
That's amazing, Claudia. Thank you for that. So at this point, I also, just as Carmen and Claudia pointed out earlier, just a reminder to everybody to please check out the awards page for more details. You can do that via the mobile app or on the actual meeting platform. And when you click the awards tabs, you can find out more information. So we'll end this session just a little bit early and give you all a little bit more time in your break. So we will have a 10-minute break now, and then please return back at 1 p.m. for the Federal Tech and the COVID-19 response session. Thank you both so much and enjoy your day. Take care.